Welcome back to Medic Farm. As previously we talked about history taking, today we are going to speak or deal with physical examination, specifically general examination. The important things to consider when doing general examination: first, we should look for consciousness. If the pediatric is alert, lethargic, irritable, unconscious. The second is orientation to people, place, and time. The third is physique and nutrition of the pediatric, on which if it is obesity, wasted, or any abnormal fat distribution. We should go to the hair, on which in hair we look for color, hair distribution, if it is normal or sparse, and also hair texture, if it is soft, silky, coarse, or dry. Next, or the fifth thing to consider is head, on which on head we look for the size, if it is normal or microcephaly or macrocephaly. And also we should look for a shape of the head, if it is normal or abnormal. If the child is below 18 months, we should look for anterior fontanelle, which closes at 9 to 18 months maximum. And if it is still open, we look for bulging, that indicates increase in intracranial pressure. And if it is depressed, it's the sign of dehydration. We also look for the posterior fontanelle, which closes at 2 to 3 months. Number 6, we should examine the face, on which we should look for shape, if it's normal or moon shaped, that indicates kwashiorkor, with other associated symptoms of generalized edema, or if the face is old man's face, that indicates marasmus, with the association of loss of subcutaneous fats. Other abnormalities of face are on forehead, on which we can find epicanthic folds, and also ears. Check if they are small or normal. And also we look upward sweeping palpebral fissures, and also we check for nasal bridge. On number 7, we examine for the eyes, on which we check for their position, if straight or slanted, and if there's any obvious discharge on the single or both eyes. And we should also consider the amount, color, smell, and texture. And also we should observe if the eyes are normal or sunken. And also we should check for scleral jaundice and conjunctival paleness, whether mild, moderate, or severe. We should also examine the lead reflex, the eyes, and also if there is any sign of cataract or any features of vitamin A deficiency, such as vital spots, keratomalacia, and also xerophthalmia. Number 8, we examine the nose, if there is any obvious discharge, and also we should look for the shape of the nose, the position, and if there is any abnormality. Number 9, we examine the mouth, on which we look for angular cheilosis or stomatitis, which indicates iron and vitamin B deficiency. The other, we look for cyanosis on the lips. We also look for dry, cracked lips. And also we examine the tongue, if there's any sign of glossitis, rash, or hairy leukoplakia. We also examine the oral cavity, if there's thrush or cleft palate. And also, number 6, we examine the inflammation or reddening or swelling of the throat, and any sign of tonsillitis. Number 10, we examine the ear on the setting, if normal set or low set, for example on Down syndrome. And also we look for any obvious discharge. We are advised to use the otoscope for tympanic membrane examination. And also number 11, we examine the neck, on which we look for the size, if normal, shorter or longer, and if there's any webbing or any masses such as goiter. And also we examine the lymph nodes. On lymph nodes, we normally examine the superficial lymph nodes enlargement, on which we look for the site. There are several sites where lymph nodes are present. The size, the discrete, if it is discrete or matted, and also if the lymph node is tender, and also we check for the surface, the edge, the consistency, if it is hard, soft, rubbery, irregular or regular, and if nodular, smooth or round. We also look for mobility of the lymph node, but usually it is mobile. Number 13, we look for the extremities, on which we check for the skin texture, if they are warm, cold, dry, sweaty, and also we look for capillary refill, and normally should be less than 3 seconds. And also we look for the finger crabbing, the splinter hemorrhages, the palmar creases, which mostly are found on Down syndrome, and also the palmar pella. We also check for syndactyly, polydactyly, and also clinodactyly. The 14th, we check for or examine the edema, if it is pitting or non-pitting, and also we should locate the edema if on the pedal, pretibial, sacral, or anasaka. We should also examine the back, which we should determine if it's normal or if there's any forward bending or lateral bending. Then we examine the dehydration status, whether it is none, some, or severe dehydration, on which we should look for the level of consciousness, alert, irritable, or lethargic. Second is the eyes, if are normal, sunken, and also drinking ability, if normal, eagerly, or unable to drink. We can test with giving ORS with water, even to children below 6 months. We should also look for the skin to go, if normal, or if the skin pinch goes back slowly, less than 2 seconds, or if the skin pinch goes back very slowly, more than 2 seconds. And the skin pinch should be done on anterior abdomen, lateral, right to the umbilicus. After that, we go for anthropometric measurements, on which first we should measure the body weight on admission and also currently, and also the height if above 2 years and can stand unsupported, and also length for those who are less than 2 years or less than 2 years but can't stand unsupported. And this should be done by 2 people for accurately measurement. And also the head circumference, which should be taken for those who are less than 3 years, and if the standard deviation is above 3, it indicates hydrocephalus. Lastly, we should look for the mid-upper arm circumference, MUAC, which is done for those above 6 months for measure of wasting. From 6 to 59 months, the MUAC should be above 11.5 centimeter. For those who are 5 to 9 years, the MUAC should be above 13.5 centimeters. And those from 10 to 14 years, the MUAC should be more than 16.0 centimeters. Please note this: Weight for length is a measure of acute wasting in children less than 2 years of age. Weight for height is a measure of acute wasting in children 2 to 5 years of age. Weight for age is a measure of being underweight for children below 5 years. And also body mass index for age is a measure of being underweight for children greater than 5 years. After examining, we should check for the vitals, on which the temperature should be recorded in degrees of Celsius. The pulse should be recorded regarding the rate, which should be in beats per minute. The rhythm, which can be regularly irregular, or regularly irregular, or irregularly irregular. And also the synchronicity, whether it is synchronized or desynchronized with the collateral limb of femoral pulse. The third, we should measure the respiratory rate, which is recorded in breaths per minute, and also the blood pressure, which is recorded in millimeters of mercury, on lying or sitting, and also we should measure the mean arterial pressure. And also we should measure the oxygen saturation, whether on room air or in oxygen. Okay, thank you. Let's meet on the next session. Please continue watching MedicFem.